As the Northern Hemisphere winter approaches, we continue to see concerning trends for COVID-19. Among the relatively few countries that report them, both hospitalizations and ICU admissions have increased in the past 28 days, particularly in the Americas and Europe. Meanwhile, vaccination levels among the most at-risk groups remain worryingly low. 2/3 of the world's population has received a complete primary series, but only 1/3 has received an additional or booster dose. COVID-19 may no longer be the acute crisis it was 2 years ago, but that does not mean we can ignore it. Countries invested so much in building their systems to respond to COVID-19. We urge countries to sustain those systems to ensure people can be protected, tested, and treated for COVID-19 and other infectious threats.
To be very clear that the COVID-19 vaccines that are currently in use are protective against the variants that are in circulation, including the variants of interest that are in circulation and the variant under monitoring, this one where we have less than 200 sequences worldwide, the variant under monitoring BA.2.86.
Now to cholera. Last week, WHO published new data showing that cases reported in 2022 were more than double those in 2021. Preliminary data for this year suggests 2023 is likely to be even worse. So far, 28 countries have reported cases this year, compared with 16 during the same period last year. The countries with the most concerning outbreaks right now are Ethiopia, Haiti, Iraq, and Sudan. Significant progress has been made in countries in Southern Africa, including Malawi, Mozambique, and Zimbabwe, but these countries remain at risk as the rainy season approaches. WHO is providing essential supplies, coordinating the on-the-ground response with partners, supporting countries to detect, prevent, and treat cholera, and informing people how to protect themselves. To support this work, we have appealed for $160 million and we have released over $16 million from the WHO Contingency Fund for Emergencies. Now to Libya, which is no longer in the headlines, but remains in a state of crisis following the devastating floods a few weeks ago. Officially, more than 4,000 people are dead. More than 8,500 are missing, and more than 30,000 have been displaced. Only a third of hospitals and half of primary health centers remain fully functional due to structural damage to health facilities and hospitals, lack of medicine and medical equipment, and shortages of health workers.